market.
This version of health care reform did not receive one Republican vote. You almost have to say that again to let it really sink in. Not one Republican vote. And a lot of people wonder how a bill, or now a law, could be good for the American public in general when it didn't receive one single Republican vote, and when a recent poll said 50% of people aren't in favor of this plan. How do you respond to that?
Well, look, I think that the Republican Party made a calculated decision, a political decision, that they would not support whatever we did. Right? I mean, there was a quote by a well-known Republican senator who said, "This is going to be Obama's Waterloo." This is going to we're going to bring him down just the same way that we brought down Bill Clinton by making sure that health care fails. And I think that's unfortunate because when you actually look at the bill itself, it incorporates all sorts of Republican ideas. I mean, a lot of commentators have said, you know, this is sort of similar to the bill that Mitt Romney, the Republican governor and now presidential candidate, passed in Massachusetts. A lot of the ideas in terms of the exchange, just being able to pool and improve the purchasing power of individuals in the insurance market, that originated from the Heritage Foundation.
And so you think it's all politics? It's well, not about the inner workings of the bill, it's all politics.
I will say that any objective observer looking at this bill would say that this is a middle-of-the-road, centrist approach to providing coverage to people and making sure that we are also reducing costs. I am frustrated that Republicans, who I think had an opportunity to help shape this bill, declined that opportunity. That's not to say that on specific provisions there might be legitimate concerns that they had, philosophical concerns that they had. Some of them, I think, sincerely believe that we should do more on this aspect of the bill or that aspect of the bill, but the overall architecture of it was actually something that was right down the middle.
Daniel Henninger, who's the deputy editorial page editor of the Wall Street Journal, had an interesting take on it, Mr. President. He said, if you produce a bill that even Olympia Snow of Maine cannot vote for, you have not produced legislation for the generations. You've produced once-in-a-lifetime legislation that no Republican from any constituency across America can vote for. What's your response to that?
And my response is, well, number one, the Wall Street Journal editorial page generally isn't favorable to much of what I do. But I think what's interesting is that if you actually break down the specifics of the bill, you will see that this historically has had a lot of Republican support. There historically was a lot of Republican support for the notion of an individual mandate, that everybody should take responsibility. There was historically a lot of Republican support for the idea that we should make sure that entitlement reform exists within Medicare. There was historically a lot of Republican support for the idea of the exchange, which is the centerpiece of the bill. So if you actually look at the particulars, these are all things that in the past, others, including the Wall Street Journal editorial page, have endorsed, and yet,
what you keep coming back to is that the fix was in, is what you're basically saying.
I think what happened is that they made a calculation, which, if you are thinking in terms of short-term politics, you can see the argument. Their attitude is, look, if we stop this bill, if we paint it as and we stop this president here, then that will give us a lot of political benefit in November.